Hi, I'm Felicia. I'm your nurse today, and I'll be taking care of you. I've already washed my hands, put on my gloves. I have on a mask to protect you and me due to coronavirus and COVID-19. So can you please verify your name, sir, and your date of birth?
Jerome McElwain, June 12th.
Okay, thank you so much. Now, Mr. McElwain, today I'm going to do a head-to-toe assessment on you.
Okay.
If you have any questions or if you don't understand anything, just please let me know. I don't mind repeating myself. And then after I'm done, then the doctor will be in to see you, okay?
Okay.
So first of all, I'm checking your general appearance. It looks good. Your skin is consistent. You're light brown. You have a little skin discoloration, and I know that's due to the tattoos on your arm and the little shading, so that looks good. You got any questions so far?
Oh, no, ma'am.
Okay. You was quiet, so I wasn't sure.
Yes, ma'am.
Okay, so yeah, you look well nourished. It looks like you eat pretty good. You eat 3 times a day?
Probably 4.
Probably 4. Okay, so you're eating pretty good. Okay. So I'm going to start by, I'm just going to inspect your scalp. And it looks really good. Checking your cranium, checking your hair, good texture. Thank you. That looks really good. And I'm observing your face. And your face is symmetrical. I like that. That looks good. You look like you're in a happy mood today. You having a good day?
Yes, ma'am.
Good. And I'm going to actually have you to smile for me so I can check your cranial nerves 7 and 12. So can you smile for me? Thank you. And then I'm going to have you to clench your teeth. Clench. Good job. Yeah, show your teeth. Thank you. Clench your teeth. Thank you so much. And then also clench your eyes. Like close them shut real tight. Okay, and can you wrinkle your forehead? Good, okay. You're doing really good on this test. And then can you smile for me? Good, and then stick out your tongue. Okay, move your tongue side to side. Good, puff out your cheeks. Good, you're doing really, really good. Thank you so much. Now I'm going to inspect your mouth. I'm going to look at your lips. So I may be touching you, okay? And then I want to look at your teeth. If you can open your mouth for me, let me look at your teeth. Okay, good. And then I'm sorry for touching you, but my hands are clean and I do have on gloves. I want to look at your gums. They look good and healthy. I want to look at your tongue. You want to hold your tongue out for me? Good. And hold your, okay, and then hold your tongue up so I can look at the floor of your mouth. Good. And you want to open up. I'm going to look and see if I can see your tonsils. Open up real wide and say, ah. Good, good, good. Are you having any sore throat?
No, ma'am.
Okay, swallow for me a little bit. Okay, and open your mouth real good, but don't say, yeah, say ah one more time. Okay, your tonsils are a good grade. They look healthy. They're pink. And I'm glad to know that you're not having like any sore throat or anything, especially with the coronavirus going on, okay?
Yes, ma'am.
Good. And what I did with that, when you said I was checking your soft palate and your uvula, okay? Now I'm going to palpate your maxillary sinuses and your frontal sinuses. Just checking all of that for you. And that all feels good. I'm checking your pre and your post-ocular lymph nodes. And I don't feel anything that's swollen. That feels good. I'm checking your external and your external process. That all feels good there. Any tenderness?
No, ma'am.
Okay, I don't feel any edema or nodules. Okay. Now I'm going to check what we call the 6 cardinals of gaze. And what I'll do is I'm going to hold my pen light up and I'm going to have you to follow my pen light, okay?
Okay.
So this is going to be like the center of your nose. I'm going to go out about 12 inches. And then every time I move it, I just want you to follow it, okay? You ready?
Yes, ma'am.
Okay. Good. I don't see any nystagmus, which meaning the quick movement of your eye. Your eyes look really, really healthy. And then I want to also check perla, which means we're checking your pupil size, accommodation, the shape. And then during this test, I'm gonna turn the light off, okay? So I need to see, okay? So let's turn the lights off. Okay. And your pupils do restrict. So you have Perla, which means good accommodation. Let's turn both of the lights back on. You okay?
Yes, ma'am.
Okay, because sometimes that kind of can throw you off a little bit when the lights are off and the lights come on. So I'm glad to know you're doing okay. And then I'm checking your conjunctiva and sclera. It looks good. It's good and white, it's clear, no drainage. Any eye pain or anything like that?
No, ma'am.
Okay, good. And I want to check your external ears.
Okay.
Any tenderness when I touch?
No, ma'am.
I don't see any edema. And I'm gonna look at down your canal. It looks good and clear. I don't see any drainage. They're good in a line. Any tenderness?
No, ma'am.
Okay. No lesions on this side either, and it looks good and healthy. No drainage. No, I don't even see wax. I mean, you're just good and healthy. I don't know what we're gonna tell the doctor, but you're doing really, really good. So now I'm gonna look at your nose.
Okay.
And your nose looks symmetrical. And I want to check the patency of your nose. I don't see any lesions, by the way. So when I press on one side, I want you to blow, like blowing your nose, and I'm gonna check the other side. Okay, you ready? Mm-hmm. Okay, go. Blow. You blowing out? Okay. Blow on the other side? Okay. And then I'm going to look. You have good paint, so I just want to look at your nasal mucosa. Good and clear. Oh, you got good hairs in there. They look good and clean, so that looks good. Okay. The next thing I'm doing is I'm going to inspect your. You good?
Yes, ma'am.
Okay, I'm going to inspect your neck. Your neck looks symmetrical. Okay, and I want to check. I want to check and make sure there's no pain. So I'm going to press down, lift up for me. Good. Okay, and I'm going to turn your face to the side. Any pain there?
No, ma'am.
Okay. Any pain or discomfort?
No, ma'am.
Okay. And I'm going to hold your face, and then I want you to press up against my hand. You're leaning to your right side.
Okay.
And I'm pressing, so you press against me. Any pain when you do that?
No, ma'am.
Okay, let's try the other side. Any pain when you do that?
No, ma'am.
Okay, good. Okay, and then I want to check your carotid pulses. Good and strong. Good rhythm. Good and strong. Okay, and then I want to check your cervical lymph nodes. That feels good. I don't feel any lumps or anything. Any pain when I do that?
No, ma'am.
Okay, good. I'm glad to hear that. We checked, and when I was telling you to lift your arm, move your face, I was checking your range of motion.
Okay.
Okay, and now I want to have you stand up. Okay, and have you turn to the side. I'm checking your AP, a lateral diameter, and it is 1-to-2 ratio, which is good. That's good and healthy. And then I'm gonna listen to your lungs. Okay.
All right.
All right. You ready?
Mm-hmm.
And I want you to take a deep breath in and then blow out through your mouth. Okay. You ready?
Mm-hmm.
Okay. Take a deep breath in. And again. Good. And again. And again. You blowing out through your mouth?
Yes, ma'am.
Okay. And again. Good. And again. Good. And again. And again. And again. And again. Okay, keep standing. I'm going to check your back, sir, okay? And take a deep breath in and blow out through your mouth. And again. And again. And again. And again. Sounds good and clear. And again. Do that side one more time, sir. Okay. And again. And again. One more time. And then one more time. Okay, you can have a seat. Now I'm gonna check your axillary nodes. Now this may tickle a little bit, so I do apologize.
Sorry. My service dog.
This is your service dog.
Yes,
Oh,
ma'am.
it's okay. Okay. At the VA, a lot of the veterans bring their service dogs. So let me know while I'm doing this, sir, if there's any pain. I'm just checking to make sure I don't feel any nodules. Any pain there? Any tenderness?
No, ma'am.
Okay. Okay, good. Let's check the other side. Any pain?
No, ma'am.
Okay. Nothing there? No pain, no tenderness. I don't feel any nodules,
No.
any. So that's nice to know. Okay. Now I wanna and you can stay seated for right now. You don't have to get up. I wanna listen to. You got any questions so
No,
far?
ma'am.
Okay, I wanna listen to your heart sounds. I'm gonna listen to your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral valve. So I'm gonna listen to 5 heart areas. Okay.
Yes,
All
ma'am.
right. Okay. Okay, so the first one I listened to was your aortic, and this is your pulmonic. It's good and strong. And now I'm at your Erb's point. Okay. I'm at your tricuspid. Hear the S1 and the S2 earlier. And then I need the listen to the mitral. No murmurs heard. Your heart sounds really good and strong, good rhythm. Okay, good. Now we want to check your abdomen area. This may be a little difficult because you're sitting down. So I'm going to be doing some deep palpation, and then I'm going to listen to your bowel sounds, okay?
Okay.
So first I'm going to do just palpate. I see your abdomen looks symmetrical. It's contour, it's round. It's definitely soft, which is good. So I'm just going to be pressing right now, okay?
Mm-hmm.
All right. All right, now I'm just doing light palpation with the right upper quadrant. And this is your left upper quadrant. I don't feel anything. It feels good. Right lower quadrant. And I'm not hurting you, am I?
No, ma'am.
Okay, and then your left lower quadrant. Okay, now we're going to do, that was light palpation. I'm going to do deep palpation. in the same areas. Let me know if I'm hurting you, sir.
Okay.
Okay. I don't feel any masses in the right or the lower quadrant. So let's check the left side. Deep palpation on the left upper, left lower. Okay, don't feel anything. Now I'm gonna listen to your bowel sounds in each of those quadrants, okay?
Okay.
And you just breathe normal. Okay, that was the right upper. Now I'm gonna listen to the lower right, I'm sorry. That was the right upper quadrant. Did you just eat?
Yes, ma'am.
Okay, I can tell. Let me get out of the way so the camera can see. And that was the left upper. And that was the lower, left lower. And you have normal bowel sounds. I can tell you just ate, that's good. I can also hear your phone vibrating, so I think somebody's probably trying to call you, so that's good. And then, you feel okay now?
Yes, ma'am.
Okay, good. You're doing really good, Mr. Drama. We're almost done. So the next thing we're gonna do is we're gonna do what we call your cerebral function. And what I want you to do is you hold your arms out. Don't do it yet till I explain. You hold your arms out. You close your eyes, and then you take turns touching your nose with your pointer finger. Okay?
Okay.
So I just need you to do that a few times. Make sure you close your eyes before you start, okay? Whenever you're ready, you can start. And use your pointer finger to touch your nose, one arm at a time. Good. Good, okay. Now, what we're gonna do is what we call rapid movements. And what I'll do is my hand is gonna move kind of fast. Your eyes are open during this test. You'll touch your nose, and then you'll touch my finger, okay? And just my hand's gonna move kind of fast. So touch your nose, touch my finger, touch it. Now I'll keep moving my hand, okay? You ready?
Mm-hmm.
Okay. Start here. Okay. Okay, I'm going fast. Good, okay, you did really good with that. Now we're gonna do what we call the heel down to shin, where we're checking your shins. You take your heel of your foot and roll it up your leg all the way up to your knee a few times, okay? And that's checking your shin.
Standing up for this?
No, please don't, because you'll fall. Just take your heel of your foot and just roll it up your leg. Yeah. Just keep doing that a couple of times. Okay, now you're doing it on the side. Can you get it kind of in the front?
Oh, like this?
Yes, sir. Good job. Okay, and do the other one. Okay, that's pretty good. Thank you. Now, what I need to do is check sensation. And what I'll do is, I don't have a cotton ball, but this is close. It's like the little round cotton ball. But I'm going to rub this on your arms, and your feet, and your legs, and your hands. But I do need you to, if you want to pull up your pants legs for me before we start. And what we're doing is, like I said, we're checking your sensation. And then I'm going to need you to take your socks off, because you probably won't feel this soft cotton through the socks. You're doing really good. Okay. And during this test, you want to close your eyes, okay? All right. And just whenever I touch you, tell me where I'm touching you, okay? You ready to start? Okay.
My arm.
You have to tell me which arm, okay? Let's try it again. Okay?
My right arm.
Okay.
Left arm. Right hand. Left hand. Right foot. Right foot again, or right leg.
Okay.
Left leg.
Okay.
Right foot. Left foot.
Good. You did really good on that. Okay. And then the next step is we're gonna be checking like your posture and I'm gonna observe how you walk and that kind of thing. Okay. So I'm gonna have you can if you want to put your shoes back on or socks back on. Take your time, and we're almost done.
Okay.
Okay, and I'm gonna have you stand up, and I'm gonna have you touch your toes, and then I'm gonna just checking your spine. No walking yet.
Okay.
Just stand up and touch your toes. Bend down and touch your toes as far as you can go. I'm just checking to make sure you have your spine and stuff is straight and this range of motion and stuff is good. Okay, and now I'm gonna have you. You can stand back up. That looks good. Is walk across the room.
Okay. So, where? Go now?
Yeah, just walk that way. Okay, good. You walking good. Now come back and walk on your tippy toes.
Tippy toe.
Mm-hmm. Okay, now walk back across on your heels. You okay?
Mm-hmm.
Okay. Okay, good. Now you can walk back over here.
Regular?
Yeah, regular walking. Okay, now you can stand back in right in front of your chair. Now what we're gonna do is something called the Romberg test.
Okay.
And this is where I'm checking your balance, okay? So what I want you to do, and it's gonna take about 20 seconds, I want you to close your eyes and just stand still. You ready? All right, here we go. You're doing good. We got about 10 more seconds left. Okay. Okay, you're good. You can open your eyes. You did real good. And just, you can have a seat.
Okay.
You good? Okay, you can have a seat. And I didn't check, but I don't think, I just want to just look and make sure you don't have any jugular vein distension, meaning that could lead to right or left sided heart failure, and
Yes,
you
ma'am.
do not have any veins or anything sticking out. And when I felt, I didn't feel like any pulsations or anything like that. I did feel your carotid pulse, which was supposed to be feeling, and that was a very good, strong, regular heartbeat. So that was good. All your pulses seem to be good. Let's just check your your radial right quick. Good and strong. Let's check the other side. You can just relax your arm.
Okay.
Mm-hmm. Oh yes, very good and strong. You're healthy, so the doctor still has to come in here. I'm pretty much done. Do you have any questions for me or anything?
Oh, no, ma'am.
Okay, and I do need to make sure there's no pain. You don't feel any pain today. Anything that we did today, did it cause you any pain or any discomfort?
No, ma'am.
Okay, so the doctor will be in shortly, and I really appreciate your time. Thank you so much, Mr. Jerome. I thank you
Thank
so
you.
much. Okay.